What are the different pain medication in the pharmacy? So pain medication in the pharmacy is an important topic in all the pharmacies worldwide. And just to know, there was a concept that was developed by the WHO, the World Health Organization, to manage pain, and it's called the analgesic ladder. And this ladder consists of 3 steps, like step 1, step 2, step 3. And the idea behind this is to try to manage pain as safely as possible with decreasing the risk of developing dependencies. So the first step in the analgesic ladder, it consists of a non-steroidal anti-inflammatory drug like ibuprofen, ketofen, uh, and there are many different others, and paracetamol or acetaminophen in the USA. It's called like this. And the idea is to start by a certain one medication of this, and sometimes it's to combine them. And you can also add something called adjuvant, like another medication. But the most important thing, it is non-opiate. It has to be a non-opiate in this first step. And then the second step, you can use weak opiates, like for example, codeine and tramadol. They are of course more effective in managing pain. And sometimes some people will act better to codeine than other people because of how it's metabolized in the liver. But you have to take care in this step of the risk of dependency, especially with tramadol. Tramadol now, it's becoming a bit of a problem. They are discovering that more people can get a dependency on it, and it can cause this problem on the long term. And the third step in this ladder, this step contains strong opiates, for example, like morphine, methadone, fentanyl, oxycodone. And these medications, of course, are very strong in controlling pain. They are very effective, but you have to be aware that there is a risk of dependency that is very high. And it gets higher the longer you use them. And of course, in the USA, there was a problem with oxycodone. Like many people got it for pain, and then they got dependent on opiates. And this is really a big problem. But of course, you have to always ask yourself if the pain is like really strong, it is also very unhealthy to your body. So you have to discuss with your doctor and keep with him like close contact when taking this kind of medication that are strong on the third ladder. And when managing pain and the topic of painkillers, you have to always remember to not increase the dose without discussing with your doctor. Because sometimes we see this case in the pharmacy, sometimes the people, they have stronger pain and they increase the dose of the medication they already have. But the solution can be actually combining 2 medications together with a lower dose. It can be more healthy for you from the side effect point of view. Or to go up a step in the ladder with a stronger medication but with a lower dose. Because we have to avoid also the overdosage from certain painkillers. It can be problematic on the long term. So when you are having pain, depends on which level you have, always keep close contact with your doctor and the pharmacist, and always talk to them before you increase the dosage of any medication, or if you feel that the pain is not well managed. Like, don't worry, you can always ask, and that's why we are here. We can always advise about it. So I hope this helps, and if you have any more questions, you can always ask in the comments.